7 subtle warning signs you should never ignore after 60. Are you over 60 and noticing changes in your body that just don't seem right? It's easy to dismiss things as just getting older, but sometimes those little niggles are trying to tell you something important. Doctors agree. Certain symptoms should never be ignored, especially after 60. In this video, we're going to explore 7 subtle yet significant warning signs that could indicate a serious health issue. Staying informed is the first step to taking control of your health, so stick with me until the end. This information could be life-changing. Number 1. Unexplained muscle weakness. We're not talking about the normal aches, pains, and stiffness that come with age, or a bit of post-exercise soreness. This is a noticeable and persistent decrease in strength, making everyday tasks that were once easy suddenly difficult. Imagine struggling to open a jar that you used to twist open effortlessly, finding yourself out of breath, climbing a short flight of stairs that never posed a challenge before, or even needing to use your arms to push yourself up from a chair. These are not simply signs of getting older. They are red flags that warrant attention. This unexplained muscle weakness can manifest in various ways. You might find it difficult to carry grocery bags, lift objects, or even grip things securely. Tasks that require fine motor skills, like buttoning your shirt or writing, might become increasingly challenging. You might also experience trembling or shaking in your hands or legs, further impacting your ability to perform everyday activities. This type of weakness can be a sign of a variety of underlying health issues. It could indicate a neurological problem affecting the nerves that control your muscles. Conditions like multiple sclerosis, amyotrophic lateral sclerosis, ALS, or even a pinched nerve can cause muscle weakness. A deficiency in essential vitamins and minerals, particularly vitamin D, vitamin B12, and potassium, can also contribute to muscle weakness. These nutrients play vital roles in muscle function, and inadequate levels can lead to decreased strength and fatigue. Hormonal imbalances, such as an underactive thyroid, hypothyroidism, can also cause muscle weakness and fatigue. In addition, certain medications like steroids and some cholesterol-lowering drugs can have muscle weakness as a side effect. It's essential not to dismiss these symptoms as merely a consequence of aging. While some age-related decline in muscle mass and strength is normal, a sudden or significant decrease in strength should never be ignored. If you're experiencing unexplained muscle weakness that is impacting your ability to perform everyday tasks, don't hesitate to schedule an appointment with your doctor. They can perform a thorough evaluation, including a physical exam, blood tests, and possibly neurological tests, to determine the underlying cause of your weakness and recommend appropriate treatment. Early diagnosis and intervention are crucial for managing these conditions effectively and preventing further complications. Don't brush it off as simply getting older. If your strength is declining without a clear reason, it's time to see your doctor. Number 2. Persistent dry mouth. While occasional dry mouth is a common experience, particularly after a night's sleep or during periods of dehydration, persistent and recurring dry mouth, especially when coupled with other symptoms like a change in taste, difficulty swallowing, or a burning sensation in the mouth, should never be ignored, particularly after the age of 60. This seemingly minor inconvenience can significantly impact your overall health and well-being and could be an indicator of a more serious underlying issue. One of the most common causes of persistent dry mouth is medication. A wide range of medications, including those for allergies, high blood pressure, depression, anxiety, and pain relief, can list dry mouth as a side effect. If you're taking multiple medications, the combined effect can exacerbate this dryness. It's essential to discuss any persistent dry mouth with your doctor or pharmacist to determine if your medications are contributing to the problem and explore potential alternatives or adjustments to your medication regimen. Dehydration is another frequent culprit behind dry mouth. As we age, our sense of thirst can diminish, making us less likely to drink enough fluids throughout the day. Additionally, certain medical conditions, like diabetes, can increase the risk of dehydration. Ensuring adequate fluid intake, especially water, is crucial for maintaining oral health and preventing dry mouth. Consider carrying a water bottle with you and sipping on it regularly throughout the day. Beyond medication and dehydration, persistent dry mouth can also be a symptom of Sjogren's syndrome, an autoimmune disorder that affects the glands that produce moisture in the eyes, mouth, and other parts of the body. Sjogren's syndrome can lead to a range of complications, including dental problems, difficulty eating, and a decreased quality of life. If you're experiencing persistent dry mouth along with dry eyes, joint pain, or fatigue, it's important to consult your doctor to rule out this condition. Ignoring persistent dry mouth can have significant consequences. The lack of saliva can increase the risk of cavities, gum disease, and oral infections. It can also make it difficult to chew and swallow food, potentially leading to malnutrition and weight loss. Furthermore, persistent dry mouth can affect your ability to speak clearly and can cause discomfort and irritation, impacting your overall quality of life. If you're experiencing persistent dry mouth, don't simply dismiss it as an unavoidable part of aging. Talk to your doctor. They can assess your overall health, review your medications, and recommend strategies to manage your dry mouth. These might include lifestyle changes, like increasing fluid intake, using artificial saliva substitutes, or prescribing medications to stimulate saliva production. Addressing persistent dry mouth promptly can help prevent complications and improve your overall oral health and well-being. Number 3. Changes in bowel habits. While it's true that our digestive systems can become a bit more sensitive as we age, experiencing a significant and persistent change in your bowel habits is definitely a warning sign that shouldn't be ignored. We're not talking about the occasional bout of indigestion or a slight change in frequency. We're talking about noticeable and persistent shifts in your bathroom routine that last for more than a few days. This could manifest in several ways, including a sudden onset of constipation where you're struggling to have a bowel movement, or the opposite, experiencing diarrhea that just won't go away. Changes in the consistency of your stool, such as noticing it's become unusually hard, loose, or watery, are also red flags. Additionally, keep an eye out for changes in stool color. While variations can occur depending on your diet, consistently black, tarry stools, or bright red blood in your stool warrant immediate medical attention. These changes in bowel habits can stem from a variety of underlying causes, ranging from relatively benign issues to more serious conditions. For example, a sudden change in your diet, a new medication, or even increased stress can temporarily disrupt your digestive system and lead to changes in bowel habits. Food intolerances, such as lactose intolerance or gluten sensitivity, can also cause digestive upset and changes in bowel movements. However, more concerningly, persistent changes in bowel habits could be a sign of a more serious underlying condition. Conditions like irritable bowel syndrome, IBS, inflammatory bowel disease, IBD, which includes Crohn's disease, and ulcerative colitis, diverticulitis, or even colon cancer, can manifest with changes in bowel habits. Ignoring these changes could delay diagnosis and treatment, potentially leading to more serious complications down the line. It's especially important to pay attention to these changes after the age of 60, as the risk of developing certain digestive conditions, such as colon cancer, increases with age. The American Cancer Society recommends regular colon cancer screenings starting at age 45, so if you're over 60 and haven't had a recent screening, talk to your doctor about scheduling one. Early detection is key when it comes to colon cancer, and regular screenings can significantly improve outcomes. If you're experiencing any concerning changes in your bowel habits, don't hesitate to talk to your doctor. They can perform a thorough evaluation, including a physical exam, stool tests, and possibly further investigations like a colonoscopy, to determine the underlying cause of your symptoms and recommend appropriate treatment. Don't dismiss these changes as simply a part of getting older. They could be your body's way of signaling a more serious issue. Early diagnosis and intervention are crucial for managing digestive conditions effectively and maintaining your overall health and well-being. Number 4. New or worsening headaches. We all experience headaches from time to time. Stress, dehydration, eye strain, or even changes in weather patterns can trigger those familiar throbbing sensations. However, if you're over 60 and noticing a change in your headache patterns, headaches that are new, different, more frequent, or significantly more severe than what you're used to, it's crucial to seek medical advice. Don't dismiss these changes as simply a consequence of aging or stress. Your body might be trying to tell you something important. One key aspect to consider is the nature of the headache. Is it a dull ache, a sharp stabbing pain, or a throbbing sensation? Is it localized to one specific area, or does it spread across your head? Has the location of the pain shifted? Paying attention to these details can help your doctor pinpoint the potential cause. Also, take note of when the headaches occur. Do they tend to strike at a particular time of day, or are they triggered by specific activities? This information can be invaluable in determining the underlying issue. The frequency and duration of the headaches are also important factors. Are you experiencing headaches more frequently than usual? Do they last longer than they used to? Have they become so persistent that they interfere with your daily activities? These changes warrant attention, especially if they're accompanied by other symptoms. Keep an eye out for accompanying symptoms such as fever, stiff neck, vision changes, blurred vision, double vision, or seeing flashing lights, numbness or tingling in your face or extremities, difficulty speaking, confusion, or sudden weakness. These symptoms, especially when combined with a new or worsening headache, could indicate a more serious underlying condition. Several underlying health issues can manifest as new or worsening headaches. High blood pressure, for example, can cause headaches, often described as a throbbing sensation in the back of the head. Infections, such as sinusitis or meningitis, can also trigger headaches, often accompanied by fever and other symptoms. Temporal arteritis, an inflammation of the arteries in the temples, can cause severe headaches, scalp tenderness, and even vision problems. This condition requires prompt medical attention to prevent permanent vision loss. In some cases, new or worsening headaches can be a sign of a neurological condition, such as a brain tumor or aneurysm. While these are less common causes, it's crucial to rule them out, especially if the headaches are accompanied by other neurological symptoms. If you're experiencing any concerning changes in your headache patterns, don't hesitate to schedule an appointment with your doctor. They can perform a thorough evaluation, including a physical exam, neurological assessment, and possibly imaging studies like a CT scan or MRI to determine the underlying cause of your headaches. Early diagnosis and intervention are crucial for managing these conditions effectively and preventing potential complications. Don't brush off these changes as simply getting older or stress-related. They could be your body's way of signaling a more serious health concern. Number 5. Unexplained bruising. While it's true that our skin becomes thinner and more fragile as we age, increasing our susceptibility to bruising, The appearance of frequent or excessive bruises without any apparent injury shouldn't be dismissed as simply a consequence of getting older. These unexplained bruises, particularly if they are large, numerous, or appear in unusual locations like the back, torso, or face, could be a sign of something more serious and warrant further investigation. Pay close attention to the size, frequency, and location of the bruises, noting any patterns or changes over time. If you're noticing more bruises than usual, or if the bruises seem to appear without any discernible cause, it's time to talk to your doctor. Several factors can contribute to unexplained bruising. One possibility is a blood clotting disorder. These disorders can disrupt the normal clotting process, making you more prone to bleeding and bruising. Conditions like thrombocytopenia, low platelet count, or von Willebrand disease can affect blood clotting and increase the likelihood of bruising. Certain medications, such as blood thinners, anticoagulants, like warfarin or aspirin, can also interfere with blood clotting and increase bruising risk. If you're taking any medications, especially blood thinners, discuss the bruising with your doctor or pharmacist. They can assess whether your medication might be contributing to the problem and recommend adjustments or alternative medications if necessary. Nutritional deficiencies can also play a role in unexplained bruising. Vitamin C, for instance, is essential for collagen production, which helps maintain healthy blood vessels and skin. A deficiency in vitamin C can weaken blood vessels, making them more susceptible to damage and bruising. Similarly, vitamin K is crucial for blood clotting. Inadequate intake of vitamin K can impair the clotting process and increase the risk of bruising. If you suspect a nutritional deficiency might be contributing to your bruising, talk to your doctor about getting your vitamin levels checked. They can recommend appropriate dietary changes or supplements to address any deficiencies. In some cases, unexplained bruising can be a sign of a more serious underlying health issue. Certain types of cancer, such as leukemia or lymphoma, can affect blood cell production and function, potentially leading to increased bruising. Liver disease can also impair blood clotting and increase bruising risk. Autoimmune disorders, which cause the immune system to attack healthy tissues, can sometimes manifest with unexplained bruising. While these are less common causes, it's important to rule them out, especially if the bruising is accompanied by other symptoms like fatigue, unexplained weight loss, or persistent fever. If you're experiencing unexplained bruising, don't dismiss it as simply a part of aging. Schedule an appointment with your doctor to discuss your concerns. They can evaluate your overall health, review your medications, assess your nutritional status, and perform any necessary tests to determine the underlying cause of the bruising. Early detection and intervention are crucial for managing any underlying conditions effectively and ensuring your overall health and well-being. Number 6. Skin changes. While wrinkles, age spots, and a bit of thinning are a natural part of the aging process, it's crucial to be vigilant about any new or changing skin abnormalities that seem out of the ordinary. We're not just talking about the occasional dry patch or a minor blemish. We're referring to significant changes in existing moles, the appearance of new growths, sores that refuse to heal, or any other unusual skin changes that raise a red flag. Your skin is your largest organ, and it can often provide valuable clues about your overall health. Don't dismiss these changes as simply getting older. They could be your body's way of signaling a more serious issue. One of the most important things to watch out for is skin cancer. As we age, our risk of developing skin cancer increases, so regular self-exams and annual checkups with a dermatologist are crucial. The most dangerous form of skin cancer is melanoma, and early detection is key to successful treatment. Remember the ABCDEs of melanoma detection. Asterisk asymmetry. One half of the mole doesn't match the other half. Asterisk border irregularity. The edges of the mole are ragged, notched, or blurred. Asterisk color changes. The mole exhibits variations in color, including shades of brown, black, tan, red, white, or blue. Asterisk diameter. The mole is larger than 6 millimeters, about the size of a pencil eraser, although some melanomas can be smaller. Asterisk evolving. The mole is changing in size, shape, or color. If you notice any of these characteristics in a mole or any other skin abnormality, don't hesitate to schedule an appointment with a dermatologist. They can perform a thorough skin exam and, if necessary, a biopsy to determine if the spot is cancerous. Early detection and treatment of melanoma can significantly improve outcomes. Beyond skin cancer, other skin changes can also indicate underlying health issues. For instance, dry, itchy skin can be a sign of dehydration, thyroid problems, or even certain types of cancer. Changes in skin texture, such as thickening or thinning, can be associated with hormonal imbalances or nutritional deficiencies. Yellowing of the skin, jaundice, can indicate liver problems. Unexplained rashes or skin discolorations can be symptoms of various medical conditions, including autoimmune disorders or infections. Pay attention to any changes in your skin's appearance, including new growths, sores that don't heal, changes in the color or texture of your skin, or any unusual itching, burning, or pain. Keep a record of these changes, including when they started, how they've progressed, and any other accompanying symptoms. This information can be helpful when you discuss your concerns with your doctor. If you're experiencing any concerning skin changes, don't dismiss them as simply a part of aging. Schedule an appointment with your doctor or dermatologist to get a professional evaluation. They can assess your overall health, determine the underlying cause of the skin changes, and recommend appropriate treatment. Early diagnosis and intervention can make a significant difference in managing skin conditions effectively and maintaining your overall health and well-being. Number 7. Persistent low-grade fever. While a high fever is a clear indicator of illness, often prompting immediate action, a persistent low-grade fever can be a more subtle yet equally important warning sign, especially for those over 60. This isn't about the occasional slight temperature elevation after a strenuous activity or on a particularly warm day. We're talking about a consistent low-grade fever that lingers for days or even weeks, often accompanied by other symptoms like fatigue, night sweats, or unexplained weight loss. This combination of symptoms warrants attention and shouldn't be dismissed as simply feeling under the weather or attributed to the normal aging process. It could be your body's way of signaling a deeper, underlying issue. One possible cause of a persistent low-grade fever is a chronic infection. Conditions like tuberculosis, urinary tract infections, or even hidden dental abscesses can simmer beneath the surface, causing a persistent low-grade fever. These infections may not present with the dramatic symptoms of a high fever, making them easier to overlook. Autoimmune disorders, where the body's immune system mistakenly attacks healthy tissues, can also manifest with a persistent low-grade fever. Conditions like rheumatoid arthritis, lupus, or inflammatory bowel disease can cause ongoing inflammation, leading to a low-grade fever. This inflammation can affect various parts of the body, causing a range of symptoms depending on the specific disorder. In some cases, a persistent low-grade fever can be a sign of certain types of cancer, such as lymphoma or leukemia. These cancers can disrupt the body's normal temperature regulation and immune function, resulting in a persistent low-grade fever. While less common, this possibility underscores the importance of seeking medical attention when experiencing a persistent low-grade fever, especially if accompanied by other concerning symptoms, like unexplained weight loss, night sweats, or persistent fatigue. The accompanying symptoms can provide valuable clues about the underlying cause of the low-grade fever. Fatigue, for example, can be a symptom of many conditions, including infections, autoimmune disorders, and cancer. Night sweats, characterized by excessive sweating during sleep, can also accompany various illnesses, including infections like tuberculosis and certain types of cancer. Unexplained weight loss, particularly if significant or rapid, can be a red flag for several serious conditions, including cancer and some infections. If you're experiencing a persistent low-grade fever, especially in conjunction with other symptoms like fatigue, night sweats, or unexplained weight loss, it's essential to consult your doctor. They can perform a thorough evaluation, including a physical exam, blood tests, and other diagnostic tests as needed to determine the underlying cause of your symptoms. Early diagnosis and intervention are crucial for effectively managing any underlying conditions and preventing potential complications. Don't dismiss a low-grade fever as a minor inconvenience. It could be your body's way of signaling a health issue that requires attention. Taking proactive steps to address this symptom can help safeguard your health and well-being. Your health is your most valuable asset. Don't let fear or embarrassment prevent you from seeking medical attention when you need it. Remember, these are just a few of the many potential warning signs. Always trust your instincts. If something doesn't feel right, don't hesitate to talk to your doctor. Early detection and intervention can make a world of difference. Now I want to hear from you. Have you experienced any of these symptoms? What steps did you take? Share your experiences in the comments below. Your story could help someone else recognize a potentially serious health issue. And if you found this video helpful, please like and subscribe so you don't miss future videos on important health topics. Also, hit that notification bell so you're alerted every time I upload a new video packed with tips on thriving in life after 60 all for free. Your support by liking, commenting, and subscribing helps this channel grow and allows me to continue providing you with the latest information and advice. Thank you for watching, and remember, taking care of your health is the best investment you can make.